So, good afternoon. We are continuing another episode of Birth Vibes from BirthRight Rainbow. So, the aim is to educate the ladies about fertility. I'm very happy to have here Mrs. Aparna Reddy, who heads the HR of MNC, of a leading MNC. She is the All India head, and Madam is also, I'm very happy to say, a PhD, a doctorate in a doctorate in MBA. A doctorate in MBA. Thank you for coming and joining us.
My pleasure, ma'am.
Yeah.
Good afternoon.
Good afternoon. So, let me open the conversation by saying that egg freezing is now a very frequently searched topic, and it seems to be like one of those fashion things that is going on. Mm-hmm. So, Madam, would you just, from an HR point of view, you must be seeing a lot of young ladies in their 25 and between 25 and 30, which is the fertility, peak fertility age. So, what are the trends that you are seeing and how the ladies are planning their families, or what's going on basically?
Ma'am, I'm having almost 20 years of experience. And from when I started to what I'm seeing now, at least in the last 5 to 10 years, there's been a lot of change in the way women colleagues think.
Right.
And especially now with a lot of Gen Z workforce coming into the employment category, we see a lot of times they are confused.
Right.
It's not just because of, the timings. I don't see that any time they're feeling this is the right time. Because...
You mean the right time to plan pregnancy?
Right time to plan, because they have their careers, which they're taking it on top priority, the personal growth, the projects, the stabilization into the organizations, their focus on, how do we lead teams. All this is taking the first priority.
Right.
So I see a lot of women rarely are thinking about, having a family, as we used to have back then. So what do you think, ma'am? I mean, this is the generation now. This is the generation, and this is going to be the next, 20, 30, 40 years of the people who are taking the generation forward. And egg freezing, we've been hearing about it. So what time is the right time, ma'am?
Right. So, to understand what the right time is, we'll just take a few steps behind and understand the physiology. So, there is something very important called the egg reserve. Mm-hmm. So, for every lady, the chronological age, and the ovarian age, they need not be the same. So, to put it very simply, a 35-year-old lady may have an ovarian age of 25. And the reverse is also true. A 25-year-old may have the ovarian age of a 35-year-old. Mm. So what is important here is, in case a lady is confused, as you say the majority are, that's mostly because of the competition and the stressful lives they lead. If they want to postpone marriage, childbearing, the most important thing is first to have a fertility consultation and know where your ovaries stand or where your ovarian reserve is. So for this we have very simple tests, and once we determine that, we will be able to say your fertility is okay, your fertility is not looking good, and you need egg freezing.
Okay. So, ma'am, I'm seeing from a lot of women, I mean, though in the organizations, we kind of do a lot of sessions on, health-related topics. Mental well-being also plays a great role here, because it's not just a physical well-being for women, especially on the mental well-being, this has to be right. So what kind of, planning do you think, this Gen Z should do? And what do you suggest organizations like us, who has almost like 40% of the workforce in the women category? So what kind of steps should we as an organization take, to ensure, we also kind of help the women workforce here?
So one thing is they should get a little maybe financial aid, and now everything related to fertility is a little on the expensive side. The injections are expensive. Once the eggs are stored, they have to pay an annual fee for freezing them. So like we know that certain companies in US and all actually encourage their women workforce to freeze eggs, and they have insurance and they have financial aid. If that could be offered to the girls in India as well, it would be very beneficial. Leave wise and permission wise, it's only a 10 to 12 day commitment with the hospital, where they have to come for daily scans and daily injections. So I think if the ladies are frank upfront with you that this is what they're planning, if you can give them the adequate, as you said, psychological support and leave and financial support as needed, it would be a very great thing.
But ma'am, in India, I don't see the insurance companies also talking about this at this moment.
That's right.
As an organization, we might, think of a sabbatical leave, or we might think of an extended leave, because already the Indian government has done a phenomenal work in moving the maternity from 3 months to 6 months.
Yes.
Which is itself a great move.
That's right.
But I have not have heard insurance companies talking about this at this moment. So do you think, ma'am, this actually should start from the insurance companies or the education?
Absolutely.
This particular topic?
Yeah. Absolutely, because insurance was always for those things which are necessary for life, and fertility was considered non-essential for life. So since a long time it has not been covered by insurance, and as you rightly said, a few of the insurance companies are now coming forward and covering IVF treatments. So it's another step forward to cover egg freezing as well. So everything has to come, change has to come slowly. So if the awareness is built up and some movement starts, wherein even if you charge a higher premium, if you cover fertility treatments, including egg freezing, it will be really beneficial to the girls.
Okay. About this egg freezing, ma'am, we've been hearing about this a lot now from the social media, everywhere we've been hearing about it. And I see one statement, coming from senior people or, very known celebrities, that freeze your eggs and you're done. You're safe for life.
That's right.
You can have your baby whenever you want. Is this a really myth, ma'am? Or is it true that, if your eggs are frozen, you can definitely have a baby?
Right. So this is a very pertinent question. I'm so glad you raised it because, yes, because of certain statements by celebrities that they have frozen eggs and they have used those eggs to get pregnant in their early 40s and late 30s. Many people might really get the idea that freeze eggs and then, we can live our life. So one very important thing here is our egg health is an extension of our health.
Okay.
So what I mean to say is, if your diet is good, if your habits are good, i.e. there is a balanced diet, 6 to 8 hours of sleep, and moderation of alcohol, and no smoking, no hard drugs. These are some factors that really affect egg health. So if you are in a good health when you have frozen your eggs, there is a reasonable chance, as in an IVF treatment, when we counsel them, we say there is a 60 to 70% chance of a successful IVF treatment. So at one point of time, if we have frozen healthy eggs, yes, that will translate into a 60-70% chance of having a successful pregnancy from those frozen eggs.
Okay.
So in case in one round of egg freezing, we find that the egg quality is not good, or the number of eggs that we have retrieved in an egg collection are not enough, we may even recommend a second round of egg freezing. So egg freezing is just not one small simple thing. There are several, variables that can go through go into an egg freezing. But for the egg to develop, it takes 3 months. So for at least 3 to 6 months prior to egg freezing, one should look after their general health.
Okay.
It's very, very important.
In general, what is the age or the age category the girl has to be more successful, with this criteria, ma'am?
Yeah. So for Indian women at least, the peak fertility is around 26 to 30.
Okay.
And up to, let us say, 33 to 35, we have reasonably good quality eggs. So the best age is, of course, if you can do it below 30 or at least below 35.
Okay.
One more point here is, we find that in some ladies, the AMH, that is the egg reserve, comes down even below 30. So if at all this egg freezing is going on in your mind, the first thing is to go and get your egg reserve checked. Egg health is one thing that cannot be predicted seeing a lady or just examining her. We have 2-3 variables which we consider. One of them is the AMH test, and another thing is we check the ovaries and we count the little follicles. We call that the antral follicle count. So this is a test that is done by a fertility specialist between day 2 and day 5 of the cycle.
Okay.
And putting this together with another FSH test, the regularity of your cycle, we'll get a reasonable idea of what the fertility of the lady is.
Okay. Ma'am, it should be like if a woman of a girl is going and getting this done with her ex-doctor and an ex-hospital, should that be continuing with the same hospital, same doctor when she wants to really get into action and get become a mother? It has to be?
Absolutely. So when we get people from UK, US and all who come to freeze their eggs or who come to ask us about egg freezing, that is one thing that we tell them. Government of India now has a ART board in place, which is a very good thing, and they have prohibited movement of gametes, movement of eggs from within countries, and from even within 2 centers they have prohibited the movement unless there is a big protocol that is followed. So that includes an affidavit, that includes something like a court order. So it's only in very rare circumstances that you can move frozen eggs from one center to another. So please be very comfortable with your doctor and that you're going to continue your treatment with that doctor. So in other words, what madam is saying is, choose your doctor correctly, and it's a branded hospital, and make sure that everything goes well.
Exactly. So, ma'am, when, for example, a woman at the age of 25 comes and freezes her egg, and after all these tests and all, what is the maximum time or the number of years she can, she can still continue doing her career and all, and what is the maximum time she has to come back?
Right. So normally there will be a renewal of the freezing every year. We'll be contacting the person who has frozen her eggs every year, not only to pay up the financial cost of freezing the eggs, because they are in liquid nitrogen, which is quite expensive to maintain. The tank has to be checked every day that the temperature is good, that the level of liquid nitrogen is good.
Every single day?
Yes, it is checked every single day in a good laboratory that, the parameters are good, and the tank, we call it the cryo tank, that the tank is in a proper condition for the eggs to be maintained properly. Now, we do not do assisted, we do not do IVF beyond a certain point of age, that is 45 now. So it's not that we can't freeze the eggs. We can freeze the eggs for 10 years, 15 years also. But the lady's age should not be crossing 45.
Beyond 40.
Because by law, we are not supposed to do IVF beyond 45.
So, ma'am, the next question I have is, women who are actually getting into this help, do they have to really take a longer leave? Or can they really, get back to their work after the egg freezing? Can they really attend their own, office work, personal work, and continue their life as usual?
Right.
Or should there be any break?
Right. So, in one consultation, we will do the assessment. So, like, we plan the process of egg freezing. That will take about 2 visits to the hospital to do the blood works and to do one scan. That is in the cycle prior to egg freezing. So in the cycle prior to egg freezing, you may be given a few tablets, let's say a antibiotic or some vitamins or some antioxidants. Now, when the actual egg freezing starts, it starts on the second day of a menstrual cycle.
Okay.
And they will be asked to come to the hospital daily for a period of 10 days for a scan and an injection that will take an hour or two. So even if you have a half a day's permission or a half day leave, you can finish the 10 days. On the actual day of the procedure, they are administered a general anesthetic, and the actual process of egg collection takes only 20 to 25 minutes.
Okay.
The rest of the time they're kept in the hospital to recover from the anesthetic, to have a meal, and then to be able to go to the washroom, to see that they're not dizzy and to recover from the anesthetic. So the entire process that day will take about 6 to 8 hours. So that day she will have to go on leave. Now, couple of 2 to 3 days after that, there may be a little stomach pain, a little discomfort. So maybe the entire leave duration that is required will be 3 to 4 days after the day of egg retrieval. After that, they can completely go back to work. There will be no side effects and no disruption for their activities. But they do need somebody to take care of them and to sign for them at the time of egg collection and to look after them for, let's say, the next 72 hours.
Ma'am, when you're talking about someone has to sign on behalf, it should be the family members or it can be anyone?
Yes, somebody related to the family. We have some legal things. Somebody should be responsible for the lady in case she has a, any small reaction to the anesthetic or something. There should be somebody responsible to take care of them.
But ma'am, as a doctor, as a senior doctor, what do you really suggest, ma'am? I mean, this egg freezing and the kind of, honestly, the trauma the women will go through, not just physically, but mentally as well. And including a lot of financial stress, because the girls, the Gen Z I'm talking about, they are very career oriented, very career focused, for them, the career is the main thing.
That's because we are bringing up the girls and boys in an equal frame of mind.
Yeah, we are doing that. So this kind of there's a lot of financial stress also involved in this, because it's not, I don't know what is the cost, but it will be humongous according to what, the kind of egg freezing and the kind of maintenance, etc., etc. So what do you suggest, ma'am? I mean, should the natural process be natural, or these these things should be encouraged? I mean, okay, we are talking about insurance companies, we're talking about organizations supporting women, and all that is fine. But as a biologically, the body of a woman should be bearing this naturally. So how do you see this going forward, ma'am?
So as fertility specialists, we have been accused sometimes of playing God. So for the best answer to your question is, nature is always best, the natural route is always best. But as you have very relevantly raised, now the girls are under a lot of pressure, possibly because the way we have brought them up, that they are as good as boys. They're going to compete with the men, and they're in no way different from the men.
Yeah.
So, yes, the natural way is better, but if there is some constraint and you can't plan your family at, let's say, in your early 30s at least, do go in for a fertility consultation and be guided by the fertility specialist about egg freezing. Because as again you've rightly pointed out, it is a bit of a confusing decision, a financial commitment, and be guided by your doctors, and just don't simply do what your peers are doing or what the celebrities are doing, because that may not always be right, what you read in the social media.
Yeah.
And as I have said again, I'll repeat this, everyone's fertility is unique. So get your fertility assessed and plan your life accordingly.
What I really liked about this conversation, ma'am, that women in the careers, they don't have to stop their careers or, or go on a breaks just because of this. It is all about, I think it is all about planning and not pausing. So I feel this is not about just about egg freezing, and there are several factors which are associated with egg freezing. And thank you for throwing light on a lot of factors in this topic. And being a HR, I will also see that in my organization, I will also encourage, if anyone would like to know more about this topic or understand more, I will definitely give them a help in terms of guiding them to the right person and getting to know more about this topic.
Very rightly said. There should be no confusion that career and family are exclusive. They can be done parallelly. So you have to take help at the correct moment. Guidance from your HRs. I hope all HRs are warm and nice like you, Dr. Aparna. And then make correct decisions at the correct time. So we are all having a lot of information, in fact, an information overload. So I always remember this couple who came to me about 6 years ago, highly educated, 10 years married. The lady was already 38. And unfortunately, there was nothing much we could do because there were no eggs left. So I had just asked them the question, why did you come at this point of time and not earlier? So they just said, we didn't know. And because some ladies were having children in their 40s also, and also some grandmothers used to have children right from, let us say, their 21st year to their 41st year.
Almost menopause age. Yeah.
Yes. So again, this is to emphasize that all ladies don't have the same level of fertility. Probably our elders and previous generations had a better fertility because their exposure to pesticides, pollution and all was a lot less. Nowadays, everyone is hearing we are getting exposed to phthalates. That is when you heat food in the plastics, and you consume food that is wrapped in plastics. We have these phthalates and microplastics. They interfere a lot with the hormones. So we call that biosimilars. So they interfere with the estrogen, progesterone, and there are lots of things that we are still learning as to why the ovaries are becoming are losing their power at a younger age. This is not happening only in India but all over the world. Both the sperms and the eggs are losing their power.
Okay.
So again, an emphasis here, please have your fertility assessed. Take help from your organizations. They are all ready to help you. And freezing need not be a stressful affair. Take help from your family. Be open to it. Just like now we are encouraging people to talk about mental health. It's nothing wrong to feel anxious or depressed and talk to a counselor. Similarly, it's not a taboo about wanting to postpone pregnancy. Yes, somebody in the family might say, you should get married at 25, you should get children by 30. But we are aware that times have changed and things like your career are also relevant now. And you have to balance the whole thing out. So don't pause either your family or your career. And as you have said, you can take them both parallelly.
Yeah. I think more or less what I understood from this conversation, and thank you so much for your time on that. I think egg freezing is not about stopping life. It is just about planning life.
Yeah.
So I think this goes a long way, and I'm sure there will be many questions around this, and maybe in the next episodes coming forward, we'll get to hear more about this topic. Thank you so much.
Thank you very much, Aparna, for coming.